Welcome back to the 9th Ward in New Orleans. After Katrina, there was no real home for children here. They were living in limbo. More than 160,000 of them had been displaced from their homes. Remember the sea of cots in the Superdome? And after that, kids forced into emergency housing, trailers stacked row upon row with no creature comforts. The trauma of Hurricane Katrina had a long-lasting effect. A new study shows many of these kids are still dealing with anxiety and depression. More than half have been diagnosed with serious emotional and behavioral issues. Joining me now is the co-author of that study, Dr. Irwin Redlener. He is the director of the National Center for Disaster Preparedness and the co-founder of the Children's Health Fund. Dr. Redlener, good to see you this morning. It's amazing to think that 5 years after Hurricane Katrina, the scars of that storm still very much apparent in so many children here.
And they're pretty active scars, John. You know, a lot of people are falling all over themselves to say the recovery's over, we're done. But our data is showing that really there's still a tremendous amount of work to be done, especially around the needs of children. And this has been a really big problem. There's at least 20 or 30,000 kids just between Louisiana and Mississippi who are having serious problems that need help.
You know, when we look at those numbers, and let's take a look at them again, more than 50% of children in this area are suffering serious emotional issues. 38% suffer from anxiety and depression. 1 in 3 children who lived in temporary emergency housing have since been diagnosed with mental health problems. That's a huge number of kids.
Well, it's an enormous number, and to make matters worse, more than half the parents are reporting that they can't get the support service they need. They can't get the diagnosis. They can't get the treatment that the children need. They need themselves, by the way. A lot of those families are feeling extraordinarily uncertain. They're living still in unstable housing. They don't know what's going to happen next year, and they can't afford to go into a rental property. So it's a combination of uncertainty and instability for them, plus all this psychological stress. It's really tough.
Well, doctor, how is it that with all of the focus that's been put on this area, post-Katrina, all of the millions of dollars, hundreds of millions of dollars that have gone into rebuilding and trying to look out for folks, that people can't get the care they really need?
Because, well, here's a big lesson that we've never learned from previous disasters. In fact, we haven't learned from Katrina, that recovery is more than just rebuilding houses and fixing the electrical grid. We really have to include, when we talk about recovery, meeting the needs of people, of families, of restoring communities, services, economic stability, and all of that. Because if we don't do that, we'll end up with maybe some of the buildings doing fine, getting rebuilt, but a lot of families, a lot of lives still very much not rebuilt, and that is a disconnect that we need to deal with head on. In other words, when we start talking about planning for the next major disaster and its recovery, we need to make sure that we've included exactly those things you just mentioned in the agenda for what needs to happen.
Is this a lingering failure of Hurricane Katrina?
This to me means that Hurricane Katrina and the recovery from it, far from over. And so there's no snapshots of a city that you can take that will help us understand or deal with the fact that so many children still need care.
You know, there have been charges of inequity in terms of the recovery and how people are looked after. These problems that you've outlined in this study, do they break down along racial lines?
They mostly break down along economic lines, and this is another kind of
to a large degree, though, economic lines are racial lines.
There's no question about that. So people who were marginalized before Katrina or struggling in very difficult neighborhoods are much more affected than children from more appropriate higher levels of affluence. So there's something we call a poverty penalty, unfortunately, so that if there's a major trauma or disaster in an area, those that are generally speaking affected the worst and the longest will be those who are poor and those who have been marginalized prior to the disaster.
Okay, so as opposed to, you know, in addition to lessons learned and what to do about the next disaster, what do you do about New Orleans now and all of those kids who are in such need?
Well, right now we have to organize a significant infusion of money and people and mental health professionals in particular to come in and work with these families that are still out there. Part of the problem is that the governmental agencies, and this was just absolutely crazy, never did anything to allow us to track where those families were. When they went out of the FEMA trailer parks in Renaissance Village, we begged them, please make sure that the appropriate agencies can track and find these families, because it's not going to be well for them, not going to not going to be good for them. That never happened. So even finding the families to provide the service is difficult, but I think we still have to do it. And a lot of these kids, by the way, are falling behind in school, which is the other tragedy.
Yeah, more than a year.
Oh, yeah. There's twice as many as we'd expect. Kids who are too old for their grade in middle school or high school, another academic travesty added onto the emotional problems.
Well, some disturbing statistics you have identified in this, but maybe a lesson for the future. I mean, people will be more inclined to look out for these folks.
My center at Columbia University, the National Center, is going to actually continue to follow these kids and see what happens. But we're also pushing hard with appropriate agencies and government to make sure the money actually appears where it's needed.
Terrific. Good work you're doing. Dr. Irwin Redlener.
Thank you.
Good to see you this morning. Thanks so much.